and of course the ever awaited treatments and what we can really do in facial aesthetics today, and a sort of live pre-recorded but live treatment video as it occurred, and then we'll take Q&A. A few housekeeping things just very quickly. We would love, if you're happy with it, for your videos to remain on, because it's great to speak to you and to answer your questions as we go along. We'd really love you to keep your noise on mute or your audio on mute, because it makes it easier for us, of course, and less distracting. We need this to be an interactive session. Long gone are the days of webinars where we're just talking at you, so please interact with us. Start by now putting in the chat your name, where you're from, and perhaps your background professionally, nurse, dentist, whatever it might be. And I'm sure others will also interact. And the last thing is that we've got some wonderful team members on today who I'll introduce in a moment, but also some of our team from the administrative side and the information side to answer any questions that you have. So keep your questions flooding in as we're going through, whatever they're about, clinical, non-clinical, the courses, anything in regards to that, and we will answer as we go along, because at the end of it, it's very little time for questions, and actually you'll forget what you want to ask. So let's begin with who we are at Acquisition Aesthetics. So Emma's kindly done an introduction. So we've got our directors who you see there. That's myself, Priya, and Lara, who's a maxillofacial registrar, dual qualified in dentistry and also in medicine. And my name is Priya. I'm a locum consultant in plastic surgery at St Thomas's Hospital. And we both indeed have our private practices. We do a huge amount of speaking globally and educating. And we're sort of the core, or the original Acquisition Aesthetics was our brainchild at the very beginning. However, we now have an absolutely wonderful and very accomplished team that help and support us. You will hear from Emma Goulding today and Emmaline Ashley, who essentially make up the core of our academic and clinical level 7 components, and our team with team members alongside them. But we span a huge variety of team members across the nation. So we have 8 clinical sites across the UK, and actually our team members are over 50 clinical trainers, and often from varied backgrounds in medicine, dentistry, and of course nursing. And then we have a huge, what I like to say, back end or back team members or behind the scenes team members, course coordinators, patient model coordinators, administrative team, level 7 team that help everything run within Acquisition Aesthetics across all of our clinical sites, where you see live patients and inject, and the sort of running for that is a significant team that makes that all work. So let's start by talking about your reasons for embarking on a career in aesthetics. Firstly, the reasons will be personal to you and they will vary. And of course, Lara and I have our stories of why we went into aesthetic medicine, aesthetic training to begin with. But the common themes that run through every person coming through the NHS generally and wanting to do both careers, or perhaps even jump across to aesthetics, are seen here. And the themes that always come up the most are working autonomy. They want control over their weekends, control over their evenings, and then also a financial incentive. They don't want to hand to mouth anymore, and actually they want to build a future for themselves or indeed their family, and that's really important. In addition to that, very strong sort of feelings and themes that we see surround things like job satisfaction, and also building your own business and being a business owner and deciding the direction that your career will take. So have a think about your reasons for launching or jumping into aesthetic medicine, and know that actually many of those reasons across our 50 clinical trainers will also have been their reasons. And the only advice I can give is that it's really essential that you're very honest about those reasons with yourself, because they will help to motivate and build the business that you're hoping to do within aesthetics. We get asked all the time, is it a saturated market? Am I too late? There's a second shop every 2 meters down the road. There's a very simple answer to that. It appears, smokes and mirrors is the beauty of aesthetics sometimes, it appears as a saturated market when it in fact isn't. It might be saturated with what I like to call the very lower tier of people, but certainly not with your calibre of person. And if you're on this webinar, you're an HCP by default, because we ask for your PIN and you must be verified. And thus, in my opinion, with the way aesthetics is moving now, with patients looking for a more prominent and indeed higher caliber, safer injector, it's certainly not saturated with those. And in addition to that, the growth that the aesthetics market has seen, not just in the last 10 to 15 years, but in the last 2 to 3 years, has been significant, both in the UK and globally. And there are many reasons why that growth has been seen. One is, and a very significant one, is that now aesthetics is really, really deemed to be a very acceptable and achievable aim and goal for patients. It once was 20 years ago. Lara and I started just shy of 14 years ago, but it once was almost a bit of a taboo subject. And I assure you, in not even 10, but 3, 5, 7 years, it will become as much of people's daily routine as brushing their teeth and washing their hair. It will become the absolute norm to look after yourself in this regard, and why shouldn't it be? In addition to that, there's been significant regulation and within the industry and legitimization of the industry. So before, indeed, there were cowboys running it, and now with the education and training within it, it's really become legitimized and indeed recognized by the government as well. And that's significant globally. In fact, the UK is a bit behind on that. So it's really up and coming. And then the money being poured into the sector and the innovation within the sector and the research and development has been very significant. And so all of these aspects have contributed to growth, and all of these aspects tell you that it is indeed not a saturated market. Once you've done your aesthetics training, of which of course we'll talk to you about the courses and how to do that, you need to think about your end goal, because unlike medicine, dentistry and nursing, it's not 4, 5, 6, 7 years away. It's actually a progressive learning curve that you continue on. It's designed very differently to your traditional science vocational courses. And actually the end goals can be seen here categorized. Yes, absolutely, you can start your own business. It's very possible, it's very doable. And if you want absolute dictation over the way that your business grows, how it looks, the branding, the marketing, then this is a brilliant avenue for you, and especially if you have an entrepreneurial streak. Alternatively, though, you can work for what I like to call umbrella chains. So they will look after you. They will teach you for the first 1 or 2 years. Any issues, complications, problems, group discussions that you want to have are really easily accessible, because commonly these larger clinics, Cavendish clinics, Sisu, all of these groups have 20, 30 clinics within them, and many practitioners who are in a similar position to you, where they're just starting and they want to test what it's like to work within aesthetics. You can absolutely blend your career. I feel really passionate about this for very obvious reasons, because when Lara and I started, we did not give up our NHS careers, and we still haven't done to this day. And actually, I would argue that I was one of the first to establish a training academy along with Lara, and one of the first to get to consultant level doing it. And we were told constantly, you can't be good at both, you're doing half and half. That's absolute rubbish. I'm now a locum consultant at one of the leading hospitals, St Thomas's, in the UK and indeed London. So it's absolutely possible. And actually blending your career, not having to choose between the two when they so beautifully synergize up, is something you can definitely do. I would never have gained the exposure to anatomy to even be able to deliver you the cadaveric courses if I hadn't carried on being a surgeon and just left within aesthetic medicine. And lastly, one close to our heart is, of course, the teaching, training and educating side, the speaking side, the global representation. That is a very, very well-established pathway in aesthetic medicine, because it's such a new specialty, relatively 30 years old. And so actually that is an opportunity, and many healthcare professionals really love that aspect of their job. So something you can absolutely do as well. So in addition to that, the academic side is something very close to Emmaline and Emma's heart, and of course myself and Lara in the group, but we have an entire research and development arm where actually the development of the innovation, as I've spoken about, and also the research publications within this sector in particular. And Lara will go over the sector in more detail. There's skin, devices, injectables, a huge amount of research and data and publications are coming out. So if that's where your interest lies, then again, blending it with aesthetic medicine is something you can absolutely do. So without further ado, I'm actually going to hand over to Emmaline. I'm not going to spoil the surprise. I'll let you tell them, Emmaline, where you are and how you got there. And we will hear from you, one of our level 7 graduates and now one of our most significant team members.
Amazing. Thank you so much, Priya. So I am actually joining you all from the Cayman Islands, where I am currently working as an aesthetics doctor. And it's really lovely to have the opportunity to speak a little bit about my experience transitioning from having an NHS career to now actually I'm completely full-time in aesthetics. And specifically, I want to touch upon what my experience has been with acquisition aesthetics. I do have quite a unique perspective because I have gone through my entire journey with acquisition, starting as a delegate, doing my level 7 diploma, then joining the team as a clinical trainer, and then now being part of that core level 7 team with Emma as co-heads of education, which is amazing. So when I've done this talk in the past, I've kind of gone and focused on quite a linear journey and progression through. I think what's probably more helpful and more interesting to you all is to go through, first of all, why acquisition? Why did I choose them? And of course, touch upon the actual training, my personal experience, which is excellent. And obviously, I wouldn't be here speaking to you if it wasn't the case. But most importantly, the tangible benefits that I have had having done my training with acquisition and the tangible benefits to my career, as well as, just all the personal and professional development. So why acquisition? In a nutshell, I became completely obsessed with this medical specialty aesthetics. And it was really clear to me that I was going to take it very seriously. I wanted to be really safe and really competent, and I wanted to be really, really good. And I thought, I'm going to do that level 7. That is the standard. I'm going to get to postgraduate training and have this proper qualification done. But who am I going to do this with? So there was this really intense period of research that started, and I looked at every single provider who was offering the level 7. And anyone who's ever met me knows I'm really type A, I'm very meticulous. And when I say I spent hours researching, I really did. But acquisition just stood out to me right away. And there were a few reasons, but a biggest part of it was the clinical faculty. So while I had been thinking, dreaming about this career in aesthetic medicine, I had already identified over the preceding years a few standout clinicians who I really, really looked up to. And so there were these women doing all these really interesting things and having careers, like I said, that I dreamed of. So I was seeing clinicians like Priya and Lara, who were surgeons, still working within the NHS, as well as working in aesthetics, building their own businesses. And I thought, oh, that is really interesting. Um, and at the time, I wasn't really sure whether or not I wanted to step away from the NHS completely. And I could see other doctors who were part of the faculty who were, for example, Dr. Beebe, I could see, oh, she's working pretty almost full time in A&E, but also running her own clinic in central London and working with skincare brands. And wow, that looks like an incredible career. And then I saw other doctors as well who actually had made that jump to being full time in aesthetics. So, for example, Dr. Ami, I saw, oh, look, she's in the specialty completely. She's speaking at conferences. She's co-founding the Black Aesthetics Advisory Board. She's advocating for better education, skin of color. There are all these incredible people doing really interesting things and having really varied careers. And it's always a pleasure for me to see personally female excellence because representation is really important in terms of being inspired and role modeling, but it was just excellence full stop. And I was excited and inspired in a way that had kind of been sucked out of me a little bit in the previous years just working in medicine, if I'm honest. And what I noticed was that all these people who I was admiring who had very different careers, they were all kind of gravitating towards the same place, and that was acquisition. So I thought, okay, there's something special happening here. I want to be part of it. I'm not going to spend too much time detailing how great the practical training and the academic side of things are because they are. I'm happy to answer any specific questions from the delegate point of view if you want to pop them in the chat. I just want to say that, now that I'm on the other side of things, I see the amount of work and detail that goes into the diploma from a whole host of people. It's really impressive, and there's a real dedication to making it the best. And I want to acknowledge that our clinical directors, that we've got two NHS surgeons who are very academic, who are well known in their NHS careers for being very evidence-based. And I do think it sets us apart because in this industry, as is often called, I prefer healthcare sector, you do see a bit of fluff, a bit of pseudoscience wellness sometimes, but we are clinicians, we're science-based. And in a specialty that is so rapidly evolving, I think it's really important to have that foundation and that scientific integrity. So what did I get out of choosing acquisition aesthetics? I know I was just waxing lyrical about all the amazing clinicians in our faculty, but it actually is really, really important. So the mentorship and the community is so vital when you're starting in a specialty. Personally, coming from that NHS background, I didn't really have a clue how to set up a business, how to market myself. Hated social media and Instagram, which no one really believes when I say it, but I did. I'm naturally, quite introverted, so having to mold myself into a quote unquote businesswoman felt like my worst nightmare. And I really needed that framework and support. And the support was amazing. The connections I made were amazing. On my very first mentoring day, I met a couple of women who became really good friends, but they were pivotal when I was getting into this specialty. So these were people that helped me navigate all the intricacies of starting a business and working in aesthetics. We could ask each other questions, bounce ideas off of one another, and they've generally become really good friends as well. We go for nice brunches together. One of them, I always stay with her in London when I come back to the UK. And it's been a pleasure to watch their careers take off and fly. They're both doing really well and they are both acquisition graduates. Um, what probably will interest the people on this diploma today is, this question of once I get this qualification, what is the main benefit in terms of having trained with acquisition, and I actually feel like I can answer that really thoroughly because I know what it's like to start in aesthetics in many different ways. So when I started out as a solo practitioner, I was on my own, just renting a clinic room in between nonstop NHS shifts and trying to get patients through marketing myself on social media. And it was tough. And there it's really tough. And that's where the network and the support system comes in, as well as the foundation of that practical and academic training. Because when you do get a patient in, you have to be really good. Once you finally get them in to see you, you want to be able to deliver the results, especially in an area that can be quite competitive. So if you're able to do that thorough aesthetic consultation because you've learned the foundations with us, if you're able to do beautiful results with injectable treatments, then you're going to be really well prepared when you start striking off on your own. There might be some on the call here who are more interested in potentially working for someone else or an already established clinic, which again can be tough. A lot of clinics don't want to spend time or money training someone up. They want to hire someone who is ready to work and will produce excellent work, which is understandable. And I've had this experience as well. So I moved to Edinburgh a few years ago. I joined a amazing multi-award winning clinic. They've been looking for an injector for about 6 months when I applied. And I went through a very intense interview process. So it was 3 stages. I was trade tested, and I did end up getting the job. And when I was speaking to the clinical director, she said to me, when you sent in your CV, I saw who had trained you and I knew you were going to be good. And that's a true story. And I remember I saw Priya at AUCC a couple of years ago, and I thought I really have to tell her about that because that kind of feedback speaks to the fact that acquisition has a reputation now that precedes itself. I think it really means something when you say you're trained by acquisition. I could talk forever, but I'm just going to finish. I'm currently in the Caribbean on the Cayman Islands. I got headhunted to introduce medical services to a skin and laser clinic here. So I was approached by a recruiter kind of out of the blue. And again, according to him, I beat out quite a few people for the job. So I'm working internationally on an island in the sun at the moment, which is wonderful. And again, it's the kind of career that maybe 4 or 5 years ago I would have just been dreaming about, but thought was somewhat unfathomable. And look, I do work really, really hard. I put all my blood, sweat, and tears into this. But I also credit acquisition with a lot of where I am now, which is why I'm so happy to be here, part of the team. And I will pass it back to the team now, but I'll be on. So any questions you want to put in the chat box or at the end, just let me know.
Okay, thanks so much, Emmaline, for that amazing story. It doesn't matter how many times I hear what your journey in aesthetics has been, it just always fills me with real thrill and excitement. And I really feel like it would make a good TV series. And if it did, then I would watch it. Okay, so I want to take it back to basics a little bit because a lot of you on this call might already have some experience in aesthetics and know what it's about. But I know that a lot of you wouldn't have touched it. Okay, it's just an idea, it's a concept, it's a word, but what does it actually mean? And so I want to break it right down to the foundation level. What are injectables? What do we mean when we talk about cosmetic injectables? So what we're talking about is essentially products or devices that we inject into or under the skin, and we use a needle and syringe to do it. It's quite simple, okay? And you guys will be very familiar with quite a number of products that we commonly use in the sector, mainly botulinum toxin or Botox and dermal fillers. And these are still kind of bread and butter treatments that probably comprise, you know, easily over 60 or even 70% of at least the injectables portion of the aesthetics industry. Just for your own understanding, Botox or botulinum toxin is essentially a muscle relaxer, and we use it to reduce the appearance of lines and wrinkles primarily and commonly in the upper face. But actually, you can use Botox or other brand names for loads and loads of different reasons, including the treatment of functional disorders such as excessive sweating or temporomandibular joint dysfunction, bruxism, gummy smile. The list goes on and on and on. Dermal fillers are where the artistry comes into it. Okay, so these are essentially medical devices. They're gels that we inject under the skin surface, and we can use them for a whole host of reasons. It's not, it's very much a spectrum of product. Okay, so the gels come in a range of thicknesses or rheologies, and you use a different product for a different purpose. So if you're wanting to hydrate and boost the skin, you use something really soft and flowy. If you're looking to recreate a bony scaffold or restore volume, you'll use something a bit thicker and place it deeper. And you can use them, as you'll be aware, for beautification treatments and cosmetic enhancements like lip filler, for example, but also mid-face rejuvenation and cheek filler, lower facial contouring, treatments that feminize a face, treatments that masculinize a face, obviously treatments that are anti-aging, and then there's a whole host of other stuff that you can do with dermal fillers as well. So it gets really interesting when you start picking up a syringe of dermal filler. But actually, over the course of the last 5 to 10 years, it's really expanded in terms of what we're doing within aesthetics. It's no longer just about freezing and filling, as it were. It's very much about a skin-first and skin-focused approach to patients. We're now utilising a lot of biostimulators, so things that stimulate more collagen production. We're using skin boosters, clever technologies that are quite novel, like polynucleotides, PRP, exosomes even. And so it really is expanding. And actually what that means is the market and the opportunity is expanding as well. So why train in injectables? As Priya's already discussed with you, the market opportunity is vast. And for everyone that's on this group, because this particular webinar is closed to healthcare professionals only, actually the market opportunity is about to take off exponentially because of the change in regulation of the aesthetics industry in the UK. Very soon, we're anticipating the launch of a new licensing scheme that will essentially make it illegal for anyone that doesn't have a license, aka a beautician or a non-medical individual, to provide these treatments. And that means that all of that business will need to be absorbed by responsible healthcare professionals like yourselves. For us, it was really about the professional autonomy. You know, as Priya mentioned, we were NHS employees, we were in the thick of surgical training, and we felt that we had no control or power over our day-to-day working routine and schedule. And we really wanted to take that power back. And going into aesthetics, setting up your own business does provide you with that newfound flexibility and autonomy. And it was just so refreshing. And I can tell you now that out of everything, that's the one thing that just does not get old. Long-term relationships with patients is something that obviously all of us will appreciate, perhaps within our own healthcare spheres, but something that I think is quite unique to the aesthetics field is actually friendships that you gain from the people that you meet working in the sector. And that's something that we didn't necessarily anticipate. So, you know, if you attend your first training course or, you know, your first masterclass, or you join the level 7, you'll suddenly be in a room with people who are ambitious, creative, entrepreneurial, and actually just people like you. As Emmaline said, you know, she found long-lasting friends on diploma and the higher training that she was undertaking with us. And I know countless other delegates that have done exactly the same, and it's a really, really nice thing to see. There is a hefty knowledge base required, so this is very much a legitimate branch of medicine and accepted as such. You need to understand your facial anatomy, advanced facial anatomical concepts that are going to guide your injection technique to make sure that you avoid those danger zones. You do not inject into the facial artery. You know where the infraorbital nerve is, and so on and so forth. You need to understand the physiology of aging such that you can then apply the techniques and the technology to reverse or slow those signs of aging. Yeah. And of course, you need to understand the actual sciences of the products that you're introducing under the skin in order to treat effectively. Now, one of the things that really, I think, offers a stumbling block, as it were, to our delegates is the consultation. And that in itself is an art form. So yes, we're all skilled in taking history, maybe doing a patient examination, but in aesthetics, it's a totally new approach. The consultation is brand new. How do you ask those very sensitizing and triggering questions about how someone feels about their appearance and the way they look? And then when you're undertaking a facial assessment, how do you do that in a systematic way? How do you document it? How do you grade it in terms of severity? What are the parameters of beauty, aging, or skin health that you're actually looking for and trying to treat? So all of that is why you definitely need to seek proper and accredited training in aesthetics. So I just want to talk about our approach to training because it's something we're quite proud of. It's something that we've developed and refined over the course of the last 11 years, at least. Anyone that comes on a training course with Acquisition Aesthetics gets immediate access to a library of resources, including written e-learning and webinars, as well as video content and a lot of protocols and linked guidance. And that's something that you will always have access to. So that's unlimited. And we're always updating that library of e-learning just for you. Historically, we were surgeon-led. So our trainers and our faculty were exclusively surgeons. And we quickly realized that if we wanted to provide a faculty and a training experience that was truly relevant and broad, then we needed to actually enrich our faculty with input from cosmetic dentists, advanced aesthetic nurses, and medical doctors as well. And so we did just that. And so it truly is an MDT approach faculty of arguably some of the most credible injectors and aestheticians in the country. Everything is evidence-based. As Priya said, we're really into our research and development, and we publish very frequently. Everything's handled for you, so you don't have to worry about the logistics of things like sourcing models, organising for product, following patients up. You don't have to worry about any of that. All you have to do is turn up with an open mind and a bit of energy. You need stamina if you're going to attend one of our courses, okay? It's quite a long day. But everything in that regard is managed for you. So all you have to do is focus on the learning and enjoying yourself. It's characterized in terms of the practical training by small group experiences, hands-on training with live models. So you'll be in a group of no bigger than 4, including yourself, delegates, training under the supervision of an expert mentor. And it's just a conveyor belt of patients who are handled for you. They're consented, their photography is all done, and you're taken through that process. But for you, it's just about getting that haptic feedback, becoming really familiar and comfortable and confident when you're holding a needle and syringe. That's where we want to get you. That's always the goal. And we don't just use anything. So there are places, actually some very well-known groups that will allow their delegates to inject with saline or water, and they're injecting mannequins. There are other groups that will treat with real product, but the product is substandard, and we would not use it on our own faces, the faces of our private patients, and definitely not on the faces of our cosmetic models. We only use market-leading product so that when you go out and do your own work, it's with a range that you trust and is going to get you the right results and do it safely. There is an enormous faculty of back-end support staff, including academic and educational support staff, to help you along your way throughout. It's not just about that hands-on day. We have sites throughout the whole of the UK, including the ones that you can see listed here. So I need to take a moment to talk you through the Acquisition Aesthetics Ultimate Practitioner Pathway. For those of you that were on the link from the very beginning, you would have seen our brand new video, which talks a little bit about the UPP, or the Ultimate Practitioner Pathway. And just for context, we sat down almost 2 years ago now, and we took stock and we said, okay, if we had to design the best training program that could ever exist in aesthetics, what would it look like? Let's just get back down to basics again. What would it have to include? We looked at feedback from thousands of people that we've trained across the UK and globally to date. We looked at, what was allowing so many of our alumni to flourish, to build their own successful businesses, and what it was that they really enjoyed and they really learned from. And so we built the UPP. We recognise that, yes, you need those fundamentals in terms of knowledge, you need the core competencies in terms of your practical skills, but you must achieve an accredited qualification. You need to make sure that you're safeguarded to continue practicing in a changing regulatory landscape. You also need to be relevant, and you need to be able to perform the treatments that are complex, yes, but also in high demand. And then you need to be a modern injector. I don't really like the word modern, but this industry, and it's a lovely thing, is always evolving. If you're only trained in quite not outdated, but traditional, should we say, methods, then you're not going to be able to compete with other injectors that are out there. And that's really important for us to make sure that all of these skills that you're acquiring and this training that you're doing is not going to be in vain, and you're going to be able to achieve the success that you're looking for within the industry. And then, of course, it's all about making sure that you can market yourself. And so the UPP is essentially a continuous pathway or journey of learning. It's designed such that if you're a complete novice, you can run through the entire thing and you can expect to achieve the standard of expert aesthetician if you complete all of the steps and do so thoroughly and engage with mentoring. But it's also designed such that you can tap in if you've already achieved certain competencies like basic level injectables, for example. Step 1 is core training. So that's essentially our foundation and advanced courses in toxin and dermal filler. It gets you to that foundation level. Step 2 is your level 7 diploma. So that's the Health Education England backed and Ofqual regulated qualification in aesthetic medicine. And this is something that is essentially the gold standard in the UK. So that really safeguards your right to practice going forwards. Step 3 is upskilling, and that skills you up in lip enhancement, which of course is always so high in demand, tear trough correction, and also the management of complications. If you nail these, you're well on your way to a very sustainable and very lucrative aesthetics business independently. But you have to be competitive, as I say. And so step 4 is our cosmetology package. It diversifies you into other forms of injectables. It allows you to treat those patients that are very skin focused and perhaps a little bit shy when it comes to fillers. And so many of our patients now are going down the route of PRP, polynucleotides, Sculptra, and skin boosters. And then our business and marketing masterclass is something we're very proud of. We've got global names and some fantastic contributors that have essentially built a recipe book, as it were, in terms of how to launch your own aesthetics business or how to make sure that you achieve real commercial success with this newfound knowledge and skill set that you have. Use the QR code to access more information on the UPP via our website. But without further ado, I will hand over to Priya, who is going to go through a beautiful patient story and journey. It's a real tearjerker, where it can be, as well as a live treatment demo. Okay.
Fab. Okay, so I get the fun bit for the last 15 minutes. So get your questions in, because we're on the home straight now for the most important part, I think, which is actually what can aesthetics do and what do you see from it? So meet Jean. Jean is well into her 70s, and she's a lady that came to see me and said all of the things that people in their 70s generally say, which is, I look tired, feel tired, don't like how I look in the mirror, and I'm not that person. She had a huge amount of zest about her, a wonderful affect. She was still working in an editorial office, and she was like, I'm really sick and tired about not looking how I internally feel, and that not matching up and not reflecting. So there were two things that were notable about her. The first was that in the editorial office, she was the only person that insisted that her image up on the kind of staff hall of fame, if you like, or the corridor, was in black and white, which I thought was really striking. And the second thing was her expectations, because I sat there and I said, really honestly to her, I said, have a facelift. Don't do dermal fillers, regenerative medicine devices, have a facelift. And she was really, really great insight. She had great insight. And she said, I don't want a facelift for A, B, C, D, E reasons. They were just her own personal reasons, which I totally understood. And she said, will you help me or not? And I said, yeah, I think I can. And I think if you do this correctly, there is a chance that you can get brilliant results that are comparable with facelifts, certainly in the short term, and actually over long-term results, which we show. So when you look at her, the first thing you'll always have to do is a full facial assessment. That is a very detailed thing to do that requires particular nuances around it. And I'm not going to do it in massive detail now. But as you would expect, from top to bottom, she has all of the aging signs. She has compensation lifting up of her brows that she's trying to do, and then demonstrates the lines across her forehead. She has heavy brows, heavy skin, come down. She has tear troughs that you can see come down. She has mid-face volume loss, mid-face skin sagging, heaviness in the nasolabial folds, and then also what I like to term the wavy jawline, or indeed for many pathological processes, the heaviness of the fat pads, the lack of the ligamentous pull and strain, and the thinning of the skin, and lack of increased laxity means everything starts falling forward. So all of the signs that we see. Now, Lara alluded to the concept of it's really important that you understand and know your anatomy, and that is absolutely essential. I think it's a tagline that people in the aesthetics industry love when they like to gloss over it. And actually, I cannot stress to you enough that doing your dissection courses or learning from somebody who sees the tissues, touches the tissues, lifts up the skin on a daily basis is invaluable in regards to your learning and setting up your foundations for future learning. So here's the plan that we made. So in terms of the layered approach is what we will teach as well on some of our far more advanced courses. We start from the top to the bottom, but mid-face was where we tackled first, then the temples, the tear troughs, the lower face, and then the nasolabial folds, and indeed even the lips for her. Understanding the anatomy allows you to layer. Without your understanding of how everything feeds into everything else, every structure interlinks and glides, you will only get the overfilled puffy look. That is done by people who have injected perhaps the incorrect product, but more commonly the correct product over a long time in the incorrect plane. The incorrect plane, that's tissue plane. That's the most important take home, that it's very easy to do dermal fillers well for the short interim period that you say, look in the mirror, you look great. And as time progresses, they begin looking a little bit strange. So let's start with what we did. We started with our mid-face as mentioned. The first thing about the mid-face is to understand that as you lose your mid-face volume, you need to restructure the maxilla coming onto the zygoma, so the bone. That is done with a higher G prime filler, a filler that has a high lifting capacity that is injected down to the bone using a needle technique. Needle, because I know that I touch the bone with the needle as opposed to something else, which I'll show in a minute. High G prime, high lifting capacity, because I know it won't show through the skin because actually I'm injecting very deep, and use of the product is undertaken because I need to restructure the bone. So that's great, we restructure the bone, but what about the soft tissue that now drapes over the bone and how that then begins to move? Well, firstly, through your assessment, you've got to identify that. You have to identify when you elevate her soft tissues, perhaps using your hand, exactly where the light reflex comes for the soft tissues to give you that curvature back to the face, feminization of the face, and youthfulness. That then needs to be highlighted through you drawing before you lie her back down, to then inject at a different depth. Now we are not on the bone anymore, but we're in the same area. We are in one of the 4 layers that sit above the bone. So we are in the superficial and deep dermal layers here now, and the superficial fat and deep dermal layers to recontour. So the layers you don't need to worry about, because you learn that with your anatomy and you learn that with your feedback when we put our hands on your hands when you're training and understanding. But now you need to ask yourself, well, why is she not using the needle? And I'm not using the needle because to understand the layer I'm in, using that long tube that you see, that silver thing, that long cannula on the end of the syringe, to understand and feel those layers with my hand, I need something that gives me the feedback, and only a cannula can do that, because a needle just pierces straight through any tissue that it comes into contact with. So you never know what layer you're in. But with a cannula and the correct trained hands, you can understand. And of course, I've taken a different product because the high G prime product that I used earlier isn't suitable here because we're placing it more superficially. That product will now begin to be seen as she moves her face. I need a product as she moves for these cheeks to become integrated into her tissues and begin moving with her. So product choice, the technique that we deposit at, and the instruments that we use to deposit are essential for you to understand in addition to your assessment and anatomy. We then move on to her upper face once we've done the mid face. Here we're doing the temple injection. Now, again, we're using a needle because I know that I get down to the bone and I want to feel that. I'm aspirating for a long period of time here, and my injection point is precise. It is precise for her anatomy and for my understanding of the anatomical danger areas of the face, where the vessels lie, the structures to be avoided, and how I need to feel and palpate. And actually, the injection point you see here is nothing to do with her eyebrow. Nothing. That is not the surface marker that one looks for. It is through feeling and touching that we can understand. We've injected down to the bone, and now I appreciate I need to relayer with a different product using a different technique, a little bit more superficial, closer to the skin. So here, again, understanding my anatomy and danger zones, I begin layering with a different product and the cannula. So an introducer needle through the dermis. That introducer needle is then removed and taken out and exchanged for my cannula that can't pierce the skin. That's why we use the introducer needle. I then go flat in order to make sure I'm in the plane that I want. I don't want to go down to the bone for her. It's too deep. I'm using a thinner product with less lifting capacity, more rehydrating capacity in order to layer her temple region, because if you keep injecting a huge amount just down to bone of one product, you're not respecting how the layers begin to age over time. So that's really, really important. We then move on to her lower face. So restructuring of her chin is essential. The mandible resorbs, different changes in men and women, different changes over the different decades, and you have to understand that. And then we need to begin restructuring the mandibular resorption. And then, of course, as is the theme, we've done the bony work here, down to bone, high G prime, know my anatomy, areas to avoid and aspirating. And then I need to begin working on the deep and superficial fat pads that surround and engulf the mentalis muscle. And of course, because I understand the anatomy and because I can teach on it and do teach on it, I can appreciate what layers I'm in when I insert the cannula and it pierces through. So we've done our bony reconstructive work, and then we now move on to doing the superficial work in 2, sometimes 3 layers, breaking up that labiomental crease, lengthening the chin if it requires it, and giving a degree of anterior projection if it's needed to match up and harmonize her face. After we've done this area now, the patient needs to be sat up for us to do a few other areas in order to harmonize that wavy jawline. Commonly, the wavy jawline is one of the greatest complaints that our patients have in regards to their aesthetic appearance because they don't like it in photographs. So for her, the reconstruction again is a mixture of layered work using needles and indeed cannulae, using different products with different rheologies that I know will age correctly over time as she ages, and all the while being very conscious of the anatomical landmarks, danger zones, ligaments, muscles, and indeed fat pads and changes that occur as we age. So we did some deeper work, and now, different to before, this is very sub or intradermal work. So I haven't gone to the superficial fat pads. I'm right under the dermis here in order to really get what I need by way of almost projection or filling, but by way of enhancement to soften that wavy jawline that she has, and you can see it forming now. The last thing that we move on to is actually Jean's lips. So lots of people are afraid of lips, doing them, having them done, giving them to their patients. And lips even today are still so poorly done. And I do fail to understand why, but it's an easy thing to get wrong. That's the problem. And it doesn't take much. to do that. So for her, we're simply looking for a hydrating procedure, minimal product to just give the degree of projection. It's almost like the cherry on top. So I'm using a very superficial deposition linear retrograde technique here, using the correct product that will integrate into her lips and move as she is moving and speaking, articulating and eating. It needs to move with her lips. So the incorrect product here can be very dangerous, as the lips are very dynamic and they move a lot. And the technique that I use and that we adopt is one of many taught on our lip masterclass. Creates minimal bruising, exceptional results for minimal product. So you get that projection and hydration that you want and that you need. And after we've done this, finally, she gets to have a look at herself. Of course, we've done it throughout. Oh, not sure.
I know, it's so great. I love your lips. Yeah, you can have a look.
It's amazing.
That's
So good.
It's literally one of our best.
I know, look at that. You wouldn't recognise me, would you?
Isn't that amazing?
That's lovely. You've even got relief.
Oh, you're so welcome. You're wonderful. It's actually been amazing treatment.
Thank you so much.
No, thanks.
And so you can see it from her dynamic movement there, that she looks natural and she moves, and her before and after photographs can be seen here. And you can see that, you know, my initial instinct for her was certainly to take her for a facelift, but actually for the results that she wanted, needed, and you can even see with the lips in the perioral region, she looks refreshed. She went back and had a color photograph. She put that up on the editorial. It's the only story I remember of her. She was just so thrilled with that in particular. And actually still looks natural. Now, what you can't see here is that we layered with biostimulators, which traditionally take a few weeks to work. And so her result after many weeks, 2-3 months actually, was even better because of the collagen biostimulation that she had. So those are her before and afters. I will now hand over to the very last and first person that started for us, who is Emma. So if you have any last remaining questions, clinical or not, put them in the chat box. And Emma, back to you.
Thank you so much. It is such an incredible result. I just love seeing that reaction and seeing that patient satisfaction, which often we don't really get that kind of feedback when we're in our NHS careers. So it's something that's a real joy when you work in aesthetic medicine. So if you've all been watching this and be getting more and more excited about the prospect of a career, a successful career in aesthetics medicine, you're probably now thinking, what are my next steps and how can I go about this? So as Lara touched upon, we have a course which is suitable for any point where you may be. So that might be you've never picked up a needle before, or you might have done quite a few courses, but you just haven't really been able to get the ball rolling. So we can do that basic training, or we can do our level 7, and we can also do our ultimate practitioner pathway. So because you've joined us on this webinar tonight, we have a really fantastic offer. And that is that you can save £1,350, which is incredible, by using the code which we'll show on the next slide. As you can see, we have multiple payment plans to make this appropriate for you and where you're currently at. And also, we only require a £350 deposit to secure this discount. So it is something that you really want to make the most of. On our webinar today, you might have been noticing in the chat, we have our fantastic team of our brand ambassadors. So they can help you get enrolled on the course that is most suitable for you, your budget, where you're at in your career. And to do so, if you scan this QR code now with your phone, you'll be able to book in a chat with them and they can talk you through everything. You can also just drop us an email or book online directly too. And the code that I was just mentioning before is success10feb. So that's the code that you want to use over the next 7 days to really make the most of that incredible discount. So let's try and make the most of having all of the team online now for the next few minutes. And if you've got any questions, please fire away and we'd love to try and help.
Okay, let's have a look. What have we got? I did see one. Emmaline, you answered one, which is great. I think previously I saw one about patients and the acquisition of patients. I think I can't see it now, so I'm sure you're on there, but addressing it to whoever it was. Can't see it, but it was about sort of acquiring patients and they'd been doing their courses. So There are a few ways to do this. The first is, this is exactly why we introduced the business and marketing component of the UPP, literally exactly why. Because people were brilliant practitioners, they knew their craft, they got great results, and they were posting a little bit, but they or advertising, but they just weren't acquiring number of patients that they should have been. And then we slowly realized that being able to post and do it yourself without a strategy actually isn't good enough anymore. And so we employed somebody when I went to the USA who's very well known out there, and he's brilliant and a wonderful chap. And then Rick O'Neill here in the UK, to come together. And I said to them, along with Lara, I said, listen, these delegates are brilliant. They're brilliant aesthetic practitioners, but why should they have to struggle in the business and marketing? They're not business consultants, and I don't want them having to pay for somebody to run their social media or their strategy. So they put together a really comprehensive webinar series. It's multiple modules that actually, if I'm honest, has had one of the best feedbacks of any of our courses on not only how to set up, but actually how to begin your strategy, employ your kind of changes that you're going to make for your media and marketing, and how to really do it yourself. A huge amount of it's tracking your data, and that takes a lot of patience. But there's a huge amount on there that is way further than post regularly, post at the right time. You know, it's really about a multimodal strategy to employ, whether you do it or you outsource it, and about the acquisition of patients and really getting into the patient's mind in your particular area and what they're looking for. So there are ways to certainly conquer that particular corner, and a lot of it's taught on the business and marketing course.
The question on thoughts about setting up a clinic in your own home or a small outbuilding or garden room. And there are a number of people that do this, you know, and they're not shy about it. And in fact, they kind of post about it. They really celebrate it. A lot of them invest quite a bit of money in decking out, you know, an outbuilding and doing just that. There are just a couple of caveats to that. Number one is, you know, you do need then an existing footfall of patients. So if you're starting from scratch and it's just you at home, well, be careful of that initial upfront financial investment, because it's all going to be required to be paid back essentially through clients that you need to bring through the door. So, you know, it might be something to consider a little bit later on, after, say, renting out a smaller space elsewhere or outside of your own home. The other thing to say is that some treatments, not many, but some require CQC registration of the premises. So that is some botulinum toxin treatments, like the treatment of hyperhidrosis, should be done in a CQC registered premises. And then the other thing to say is that devices can have those restrictions as well. Again, not all of them, but some of them. So ablative lasers and things that are, you know, a little bit more invasive will require those sorts of standards. Also, with the launch of the new licensing scheme and the changing regulations, it's likely that spaces that are not truly clinical may be at risk in being deemed not suitable. So there are lots of people out there that do it. It can definitely be done. Things to look out for are infection control. So make sure that you've got decent sharps disposal, clinical waste, that you've got good PPE, that you keep the area clean and tidy and safe. You know, make sure it's a space that people actually want to come to, so it will require decorating and everything else. You need storage, safe storage of all of your product. It needs to be temperature controlled, so you need a medical fridge for your toxin. And that's why some people find it easier to, in the very beginning, start out in a space that is already clinical. So that might be a GP practice, a dental clinic, or you know, a space that is a little bit more cosmetic or beauty orientated. So just food for thought there. Don't know if anyone else has any comments on that particular question.
No, I echo your sentiments. I think one of the last things to sort of say, unless there are any other questions, is as with anything in life or learning, whether it's your medical career or even having kids or whatever it might be, it's really important that you find your tribe and your community that you resonate with. You know, we attract a really particular type of delegate, one that really wants to learn, that wants to be safe, and actually that has really legitimate reasons for wanting to start this career: autonomy, financial freedom, sick of the NHS, whatever, those really honest conversations. So when you do your research, you've got to look at the courses and those sort of things are an absolute must. Lara's right, the products they use, the patients they treat, it's important. But one of the best things about our academy, and it might apply for others, so it's important, is that you find who you resonate with and your tribe and your community, and you'll see that in amongst our trainers that we have. But it's really important that that ends up being a fit for you, so it's the best learning environment that it can be. And I think that's really important. So that's just a sort of parting thought. Okie dokie. Well, I think, Emma, if you're happy, I think we are essentially nearly done.
Yes, definitely. That was fantastic. I hope everyone enjoyed it as much as we did. And don't forget to just scan that QR code quickly now if you haven't already. And we'll all speak to you soon. Good day.
Thanks very much.
Bye.
Bye.